All right, sorry about the wait, guys. Can you hear me? Perfect. Okay, I'm just going to go back to the presentation. So before we get started, can everybody make sure to kind of turn off their mic and their cameras just so that there's no lag and we can kind of move forward. And as for questions, we're going to have a question answer session at the end. So I'd be happy to address any questions you guys have then. And in the meantime, if there's anything that's confusing to you, you can write it down in the chat box, and then I'll try to find a way to kind of address those questions and alternate between the tabs to kind of see what you guys are asking. So welcome to the talk. We're going to be going through exactly kind of how to approach CASPer, and then a few sample questions and how to kind of address answering those questions. And then at the end, we'll have a little bit of time to address any questions. So just a little bit about me. I'm a third-year medical student at McMaster University. I did my undergrad at Western University. Sorry, I'm a medical student at McMaster, undergrad at Western. And I just wanted to plug out my Twitter account in case anybody uses Twitter. So what exactly is CASPer? So I don't know if a lot of you guys have written the CASPer exam or test before, but it's basically an online assessment that looks to see how you kind of think on the spot, and it really looks to get to the bottom of your reasoning. So using your ethical principles and kind of using your justification techniques to look at different scenarios and come up with the answer that's most appropriate to you. So that's what this exam really addresses. And it has about 12 total stations, of which 8 stations are focused mainly on video scenarios. So these are scenarios that last anywhere from 1 to 2 minutes, and they're followed by 3 questions that you have approximately 5 minutes to answer. And then you also have 4 scenarios within this exam that are text-based. So these can range from questions about your life, so personal experiences that you have had in the past, to being ethical prompts that you have about 5 minutes to answer again. And so a lot of this exam is really about thinking on the spot, really coming up with your answers fast, and making sure that you keep in mind all different perspectives when you're tackling these answers. So to kind of begin this presentation, we're going to walk through a couple of general tips that I found helpful. So just one second, I think somebody's trying to enter. Perfect. Okay, so we're just going to walk through a couple of tips that I found helpful while I was writing. And so just also remember that what I'm presenting to you today are tips that worked for me, but might not necessarily be best suited for everyone. So try them out, see how they work, and modify them to see how they fit you best for when you're writing. So the first principle, or first kind of tip that I would have, is really have your ethical principles down pat. So know these 4 principles kind of inside out when you're approaching any scenario. So the first one is autonomy. So as the word kind of states, it's basically respecting another person's wishes or what they desire. So in this exam, you're going to be faced with a lot of scenarios where you'll have somebody making a choice that to you doesn't seem right, but here you have to assess things like capacity, decision-making ability, and really kind of get to the bottom of why somebody is really thinking what they're thinking, and respect it if this person does have the ability to make well-informed decisions, or go another route if you feel like they lack the capacity to make a good decision. So really having a good understanding of autonomy will be very helpful, especially when you are faced with kind of scenarios on the exam where you're questioning whether you're questioning whether the decision presented to you is something that goes in line with your beliefs, or it doesn't in that respect. The next big principle is beneficence. So looking out for the best interests of your patients. So looking to provide, if it's a medical scenario, for example, looking to provide the best kind of quality treatment that you can. If somebody is coming in with pain, for example, and you think that they're presenting and they appear homeless, they appear disheveled, not really judging them and looking out for their best interests. So That's essentially what that principle kind of encompasses. Then you have the principle of non-maleficence. So this is this basically addresses the saying that you might often have heard, which is "do no harm." So, no matter what approach you're taking to an ethical scenario or a case that's being presented to you, your goal should be to avoid harm and provide the maximum benefit possible to within the situation that you're kind of dealing with. And finally, the last principle that you can look into is justice. And by justice, what I mean is, in every situation, you have to be realistic as much as you are idealistic. So when you're approaching a scenario, you have to really understand that you work within a system, within a world where resources can be limited, and you have to look out. You have to make sure that you're able to provide the maximum resources to the maximum number of people. And so, for example, if there's a scenario where you have $100 and there's 4 people that you have to kind of divide that money in, justice basically means giving $25 to every single person rather than giving one person $90 and the other 3 people $3.33 or something. So that would be my tip number 1. So there's a lot of online resources that I'm sure if you Googled ethical medical principles, you would be able to come across, and they can give you a big breakdown of what these principles mean. And whenever you face an ethical scenario, just try to encompass these principles in your answers. And I think that would be a very good start to how you approach your answer. The next big tip I would have for the CASPer exam is, there's going to be a lot of questions on this test that are going to look into your personal experiences. They might ask you what your biggest strength is, what your biggest weakness is, and so really starting early by compiling a list of experiences that you have had and organizing them using this CANMEDS framework. So, finding 1 or 2 examples of where you demonstrated professionalism, where you demonstrated that you were a collaborator. These can this list can be very helpful when it comes down to actually tackling the exam, because when you've divided it up into distinct kind of roles, when a question asks you, when was a time you worked in a group setting, you can quickly reference back to the experiences you have as a collaborator and be able to list it down very fast. And because this is a very time-constrained exam, having a list like this that you've already developed beforehand can be very useful in helping you kind of answer questions that come up. The next big tip I have is that CASPer is essentially a written version of the MMI. So for those of you who aren't familiar with the MMI, it's basically mini multiple interviews that are 8 minutes long, and you're given a prompt and you have to speak about that prompt without anybody interjecting you for about 8 minutes. The CASPer is very similar in the sense that you're going to be given a prompt and you're going to be left to your free will to kind of come up with an answer and write it down. And so, just practice. If you don't have a lot of CASPer material to practice, MMI questions are very similar in their nature and how they kind of are approached. So you can go online on YouTube. There's a lot of videos teaching you good techniques on how to tackle MMIs. One that I used was called Course Grinder on YouTube, which has a series of kind of videos running through the MMI. So you can start to look at these videos, start to develop an approach about how you would tackle ethical scenarios. And essentially, with the MMI, you're speaking these answers. With the CASPer, you're writing them down. So as long as you have a solid foundation and a good approach built, when it comes down to writing your CASPer exam, it'll be a lot easier because you'll be able to kind of formulate a solid answer and kind of have all the right things that they're looking for on their exam. And another thing you can do in your free time, if you don't want to type out your answers, for example, you can actually just get in front of a mirror and basically pull up one sample MMI question up and start to tackle answering it on your own in front of a mirror and really record yourself, play it back to yourself and see how you did it or see how you answered it and if there's any kind of room for improvement. And essentially by doing that, you'll be tackling 2 things at once. You'll be working towards developing those interview skills that'll be helpful later on, but also finalizing and refining your approach to ethical scenarios. So when the exam or the test does come, it'll be a lot easier for you to kind of take. The 4th big tip I have is really work on your typing speed because as much as we all are kind of we're all very good at kind of thinking on the spot. A lot of us aren't the fastest typers, and because there is this 5-minute constraint to answer 3 different questions, it's very important to be able to kind of think on the spot and really type it down as fast as you can. So there's websites such as typingtest.com that can tell you what your baseline speed is, and you can just like practice improving the speed on these websites too. And the one thing to keep in mind for this exam is that it's not really evaluating how grammatically correct you are or if you have any spelling errors in your answers. It's more so looking at if you've had any red flags in your answers, if you were very unethical in one of your approaches to the questions, or you said something offensive, or you wrote down something offensive. That's what this test is actually trying to get to the bottom of is, can you think under time constraints and still be a reasonable individual? That being said, I think it's also very important to remember that as fast as you should be typing, and you should aim to kind of be fast in terms of how you're approaching your answers because of the time constraint. Having kind of substance to your answers is more important than anything else. So if you're typing fast, but because of typing fast, you're losing the value or the meat in your answer, that can be more detrimental. So always prioritize the content, and then once content has been kind of solidified and you've kind of worked through your answer, then the next step should be try to get it down as fast as you can so that you can get as much of your answer down within the 5-minute limit. And just a tip about the CASPer. So generally, how I found this exam to be easily approachable, and the technique that I kind of used that was replicable over the different scenarios was approach each question in a very open-ended fashion. So if there's a prompt, readdress that prompt in an open manner, kind of talking about the approach you'd like to take as well as the other approach, and talking about kind of the pros and cons of each side. And then really kind of like I don't know what the word is, but essentially like a cone. So you should start with the pros and cons, and then you should taper it down so that your answer kind of builds towards what your thought process is and what you believe to be the side that you side with most. And keeping that in mind, always make sure that you do have an opinion, but you're not very, very hard kept on that opinion, and you're not using extremely strong language, because you are being evaluated by another individual, and although they do have a rubric about how they mark, if you have very, very strong language or offensive language in your answers, those things can rub the evaluator the wrong way, and it can impact your score. The 5th tip that we have is basically with regards to our company, Future Me MD. So there's a few CASPer prep courses that are offered through our website. And so when you do get closer to your exam and you're hoping to get a little bit more practice, this is a very good resource. There's a few practice tests that you can kind of go through, and then have one of our consultants kind of edit it for you and help you discuss these different prompts that you've written about. And the last big tip is if you're looking for free peer-to-peer resources, there's a new company called Prep Match. And this company essentially pairs you up with another individual who's writing the CASPer test. And essentially what it allows you to do is work with this other individual and really talk through your answers, talk through your approach to CASPer, and receive feedback from one another. So if you're interested, you can definitely check them out at prepmatch.com. So with that being said, we're going to move on to some sample questions. But before I do that, I just want to make sure I'm not missing anybody's questions. So we're going to go back here, and I'm going to just stop presenting for a second. Just 1 second. So nobody asked any questions yet. All right. So now we're going to go back to some sample questions. So after I've kind of talked to you guys about one of these questions, I'm going to stop presenting again. I'll give you guys some time to answer the question, and then we'll come back to the slide. So the first prompt is, you are a physician on duty at the local ER. A scruffy-looking middle-aged man dressed in sweatpants and an old sweater walks in complaining of severe back pain. While taking a history, the man kept insisting that the only thing that helps his pain is a very strong painkiller. A nurse quietly tells you that this gentleman frequently visits the hospital and gets prescribed painkillers. So based on this scenario, what is going through your mind right now? And I'll give you guys 2 minutes to kind of jot down some thoughts, and you can post your answers in the chat box, and then we can walk through them. And sorry, Sifti, which slide do you want me to go back to? Oh, sorry about that. Here you go. I'll just give you guys another minute or so to come up with answers, and then we can kind of walk through this. Okay, so very good answer. So completely agree with you, Pooja. I think we need to understand that one of the things that this prompt is trying to highlight is that this is somebody that could potentially be addicted, and that's definitely something we need to keep in mind. And yep, Edward, 100%. So that's another very good point. You'd want to assess what he's kind of presenting with. And then Eleanor, 100% not jumping to conclusions. So I think you guys are definitely all on the right track, where you guys are thinking about how this prompt is really the point of this prompt is to basically highlight that this is somebody that's coming in who might have a history of dependence. We don't really know that, but and a good way to approach this question is to kind of start it off like Eleanor did, where you want to highlight that you're not going to be very judgmental in this scenario. You're gonna first assess this patient, like what was mentioned about assessing their pain. Kind of see how they're coming in. Are they really in pain? What can you do to help them? Because it's very easy in these kind of prompts to get very caught up in the fact that this person has been here in the past and that they might have some kind of addiction. But what CASPer is trying to assess is, are you able to see that this is an individual who, if their past history is taken aside, is somebody that could be sick? And so the principles of kind of doing no harm and beneficence kind of come in right away, where you really have to think about, what can you do to help this patient? And like a lot of you guys mentioned, they might have a narcotics problem, they might have an addiction, they might have, some kind of dependence. And so part of doing no harm is also making sure that you don't prescribe him more meds and make his dependence worse, or, send him into an arrest, or if you're giving him opioids or something like that. And so a good way to approach this question would be kind of like this. So, not treating the patient in a non-judgmental fashion and not jumping to any conclusions right away. You want to provide good care no matter who kind of walks through the door, and you want to be approaching everybody the same way, history, so keeping in drug-seeking behavior. And so, like some of you guys mentioned, you'd want to talk to this patient and find out kind of level of pain and what kind of care they've received in the past. So that when you have all this information, you can kind of come up with a plan and see whether you need to give this individual more pain meds, you need to admit them, or take the next step. And so, it's important to always goes from the opposite angle of what's presented right away in this scenario, because I think we'll try to trick you, give a patient or a person that walks in that will have a history that makes your mind kind of think, okay, this person might be, they might be drug seeking, or they might be an alcoholic or something like that. But it's important to always, while keeping that perspective in mind, think of the other side and really treat the individual in a non-judgmental and non-judgmental fashion. So that would be a decent answer. But that being said, this is just one possible answer. Like I mentioned earlier, as long as you're able to kind of tackle these scenarios and you're able to kind of avoid seeing big red flags and being very accusatory or having offensive language in your answer, for the most part, if you can reason out your answer while looking at it from different lenses, you'll be fine for the CASPer in terms of the quality of answer that you'll have. So the next part of this question is, how would you handle the patient if he kept insisting on getting prescribed painkillers? So again, I'll give you guys a couple of minutes to jot down your answers. And I do apologize that I'm not able to kind of address each and every one of the comments about these prompts because of the limitation in time, but I'm just skimming through them and they all seem very, very good. So good question, Pooja. So in terms of approaching the CASPer, like I mentioned earlier, you don't really need to have a definitive answer at the end. You just need to show them what your train of thought is and which side you kind of lean towards more than the other. And if you don't lean towards this side, that's also completely fine, as long as you're able to kind of justify why you're right in the middle or you need more information. So like you mentioned, before deciding is a very appropriate answer if you think that's kind of how you would actually take this prompt and go forward. That being said, some questions will ask you to have an answer, and so in those ones, it's not important to be very, very definitive, but as long as you kind of show your train of thought and you have a direction you're leaning towards, that would be sufficient. So really good answers so far. I love the idea of kind of explaining the consequences of these strong. Yeah, Eduardo, great points about tolerance or how the pain is very different. For somebody that's addicted to narcotics, the same dose of painkillers that a non kind of somebody who doesn't use narcotics would need would be completely different. So really looking at their history, and yep, 100% talking about dangers of narcotics. So good point, Eleanor. There is a conflict here because this individual, they clearly want pain meds, and that's where they're trying to make decisions about their health comes in. But you being the one treating them, you know what's good in terms of the negative consequences in that medication, and so really talking to the patient, that's very important. And good point, Vipra. You definitely want to talk about alternatives, different ways in which you can approach this scenario. So in terms of kind of how this question, another approach to what you guys said, because your answers were really good too, but you definitely in this kind of scenario, you want to talk about what the consequences are of the medication. So how can they be detrimental to this individual? You want to talk about, what this person's history is. Are they somebody who does suffer from chronic pain? And is it to the point where it's kind of debilitating them? They can't function in their day-to-day life. So, those are important things to consider, because just because of that this individual has been a drug seeker in the past doesn't mean that their current pain is fake or they don't need help. The other good point that was brought up is about the alternative therapies. So whenever you have a chance in CASPer, and I know time is limited, but if you have the ability to kind of think of alternatives or different ways a situation could have been addressed, it's always very, very useful that to kind of just throw that in, because that lets the assessor know that you're thinking of alternatives. You're thinking of a solution to the problem that might not be very easy for most people to do. And so just being able to be cognizant that there's more than one way to address an issue. So instead of painkillers, maybe if they have back pain, maybe some physiotherapy or an alternative route. If you can think of those things, it can really help add value to your answer. So one of the ways to approach this answer is this answer, or this question is through this answer. So it's a challenging position, and you don't want to do any harm. So you want to try and ensure this patient is safe, and only prescribe medications if you truly believe it'll benefit this person. So again, looking at their history, making sure that this person actually does require painkillers. They do have a history of using pain meds in the past, so you want to make sure this presentation is a little different, or there is a safety plan in place in case they do overdose on pain meds. You also want to make sure that you always keep in mind the trust you have with the other individuals. So declining right away without an appropriate reason can get rid of that trust. So keeping that in mind, you want to work with the patient or work with the other person to come up with a solution. So in terms of the way this prompt was addressed through this answer, one of the ways you could deal with the pain is provide lower dose painkillers. So something like Advil or Tylenol that might not have any opioid component to it. And another thing you could do, which is kind of thinking like an alternative solution, is only give them a supply for a couple of days and ask them to refer back to the initial prescriber. So the person they talked to initially, or the physician they were dealing with initially, who might have more of a history on their pain and how it's usually managed. This way you avoid the risk of kind of indulging this person's addiction if they are truly presenting with an addictive case, but at the same time you're addressing their acute concern of the pain that they're experiencing. So the next scenario is you work at a retail store and a customer wants to return an item for $80 cash refund without a receipt, which is against the store policy. The person pleads her case, explaining that she needs the money for her child's prescription. Your manager is not available, so as the most experienced employee, you must advise the younger salesperson and make the final decision. So the first question here is, assume you advise the newer employee not to give the refund, but she does anyway. Do you report this to your supervisor? Why or why not? And I'll give you guys a couple of minutes to just answer and throw out your thoughts, and then we can work through it. So sorry, just addressing Edwin, your question about explicitly stating what ethical principle. You definitely, I think a lot of the times if you just keep the principle in mind, and you state what the principal's definition is. So, for example, if you're talking about autonomy, you can say it in other words by saying, I would want to respect the patient's wishes, knowing that they're capable of making good decisions for themselves. That basically means that you've thought about the principle of autonomy. So you definitely don't have to use like the buzzwords in your answers. And then Tala, your question, do we have to specify the alternatives, or can we just say that we would consider alternatives? So you could definitely say you would consider alternatives, especially if you're running out of time and you want to make sure that you haven't thought of this as being like the end and like the only solution to the question. But at the same time, if you're able to actually provide a concrete alternative, that'll separate you from a lot of the other applicants. And so, if you have the opportunity, I would aim to kind of really give an alternative to a solution if possible. So awesome. Just for the sake of time, I'm going to move towards like the answer for this question. So, so yes, 100% Zara, you do have a responsibility to kind of uphold store policy because you're kind of the person most in charge here, and so reporting is definitely one of the options you can take. Definitely very good point, Pooja, where you want to support your customers, and you understood where the coworker is coming from, so that's really good as well. Definitely, Neuron. So you're thinking about the alternatives, which I really like here. Perfect. Yeah. So Eleanor, you're talking about how you can, work towards, revamping the policies so something like this kind of doesn't happen again. So I think you guys are definitely all on the right line here. I think you guys all understood that in this prompt, you really need to kind of look at it from two angles, which is one, from the angle of the position you currently hold, which is as the person most in charge in this situation, where you have kind of a duty to uphold the store policies. But at the same time, you understand that your coworker, they're trying to do it potentially out of the goodness of their heart because they feel for this person coming in. And I think, Eleanor, you brought up a very good point about kind of store policy and how the next steps here could be really talking about how you can potentially change these policies so that something like this doesn't need to happen again. And I think somebody mentioned something about helping this patient out or this person out in terms of seeing if they have insurance or seeing if they have any kind of coverage or if they can maybe pay later. So good job. I think those are very, very good points about thinking about alternatives. So one potential answer to this question was, you should tell your boss about the employee's actions. And so sorry. The answer to this question would be, you could take it in different angles. So this is where you're talking about the three different approaches. So you could report it to your boss, you could confront the employee, or you could ignore the situation. So so you can begin your answer off by talking about how normally in these kind of situations you'd want to, when you're working in a collegial group, you'd want to talk to the party that made the mistake to kind of get a better understanding about why they did it. So kind of understanding, like one of you guys mentioned, maybe they were looking out for this patient or this person, maybe this person really needed help and the employee thought that it was their position or their ability to kind of help them. The other approach is reporting it to the boss. So after you've kind of talked to the employee, or after you've talked to the employee, you have to let the employee know that this is something you do have to report because you're the most person in charge, and so it's your job to kind of uphold policy. And so that would be your next step. And then, like one of you guys brilliantly mentioned, you can always advocate for your employee and talk about why they did it or their good intent behind it, and then discuss alternatives, which you guys also mentioned would be, considering a new policy where something like this doesn't need to happen again, where there is a little bit more leeway for people who come in who are more desperate for financial assistance. So question 2 would be, if you were to establish a policy for new stores around refunds, what aspects would you take into consideration? And sorry about all these questions, guys. Right after this, we'll go into the Q&A. All right, I'll give you guys about another minute to kind of send in some answers, and then we'll walk through the answer to this question. So far, very good points. I like your point about quality of the product and the severity of the situation. Naba, I think you bring up a very, very good point about how, there needs to be a little bit more flexibility and maybe giving a little bit more control to the employee to really judge, the situation the person is coming in. That being said, it's important to also remember the principles of justice. So, you want to make sure you're making as fair a policy and a policy that can't be abused by people. Yeah, so a good point about the financial situations. But I encourage you guys, whenever you guys are, talking about financial situations and making an exception to policy where, there are ways in which people can, break the normal policy, that you also talk about the other angle and how, this might not be fair for everyone and how you can kind of, work for a little bit more of a fair policy. And definitely, you want to make sure people don't take advantage of the policy. Yeah, and keeping records. That's a very. And yeah, very good point about period. So, this is an alternative that you're kind of bringing up, Kim, where you're talking about, something that could be an alternative to returning where people can have a little bit of time to see if they're happy and, no questions asked, 3-day policy or something like that. Okay, so just for the sake of time, I'm going to move on to the answer here, and then we'll go to the Q&A. So, one of the ways you can mediate the situation and prevent incidences like this is, like you guys mentioned, finding those scenarios where it would be justifiable to kind of override the policy. And, I mentioned how, if overriding the policy might kind of might make it hard to follow the principles of justice, but having guidelines. So under what situations would you be able to kind of override policy? So clearly in this case, financial barriers to medication seems to be what this individual's problem is, and so having guidelines in place for helping the community members who might not be financially well off could be a good approach. And I think one of you guys mentioned how you need to keep a better kind of record of receipts, so there is trackability, and people cannot abuse this store policy. So having people purchase through credit cards on larger purchases would be kind of an alternative about how you can approach having that permanent record about purchases and what's being bought. And I think one of you guys also mentioned something about quality of products. So in your guidelines, you could definitely have something written about how you'll only take things back if they're brought in kind of as they were taken away. And a lot of stores do that. So, all of this is, it seems as though this is all common sense. Under time pressure, it's hard to kind of, think very clearly. But as long as, what I wanted to kind of get out from these answers for you guys was that as long as you guys can really, think on the spot and, jot your thoughts down, and you avoid saying something that's very, very far field in terms of very opinionated or very biased or anything like that. For the most part, this is a very, this should be a fairly non-challenging exam to write, because a lot of the scenarios will be very similar to what you just saw. They'll be very real life based. They'll be very practical. And as long as you can kind of think from different angles and different perspectives, you should be able to kind of answer them well. So with that, I'm going to conclude the presentation and give you guys a little bit to ask any questions in particular that you guys have about this exam. So I'm going to stop sharing. So if you guys have any questions, you can feel free to turn on your mic and ask them, or you can just type them out. Okay, perfect. So a couple of questions coming in. So we'll start with yours, Edwin. So an example of what not to say for one of the prompts. So in terms of, okay, let me think, what not to say. So if we, for example, considered the came in seeking painkillers, I think what not to say would be starting your answer off by a statement such as, this is somebody who's clearly with a drug-seeking behavior, and very treat this person because it is likely that they are going to use again. Like that, starting your answer off that way can be very judgmental and perceived in a very negative manner. Although your point might be very valid that this person does have a history of drug seeking and potentially using the system to get more pain medication or medication, but being able to kind of state that same statement later on in a phrase such as, although we want to treat this individual for the pain they're presenting in, we want to make sure we're not doing any harm to them by giving them medication that they might end up abusing, as they do have a history of recurrent trips. And for this, we'd like to ask them a few more questions to kind of get to the bottom of why they're coming in today. So it's really all about how you word it. So as long as you're not very, very strongly opinionated right away, not using offensive language, for the most part, you should be fine. Next question is Vipra. So is it better to answer 2 of the 3 questions really well or answer all 3 rushed? So that's a tough question to answer, because I think, my gut, I've never evaluated the CASPer exam, and so I can't say 100% from an evaluator's perspective, but just from what I've seen, it's a lot better to kind of answer 2 out of 3 better, or 2 out of 3 well, instead of rushing all 3, because I personally found, like, even when I wrote the CASPer, there would be prompts and scenarios where by the time I got to the 3rd question, I had 1 sentence down, and then I moved on to the next prompt. And so as long as you have some substance in your answers, for the most part, you'll be fine, because I believe, from what I recall, there's 1 evaluator per question. And so as long as they're able to kind of see your train of thought and see your reasoning, even though you might have messed up 1 question, for the most part, it shouldn't affect your grades too much, as long as you write something down. Is there a specific amount of words you need to write down? So there's no specific number of words that you need. Just kind of as a rule of thumb that I've used in the past and that I've heard other people use is, you should aim to have 3 to 4 lines per answer. And usually that's sufficient in terms of the amount of information that you're giving, because although there isn't a word limit, you also want to make sure you're able to communicate your thoughts well and really get all your ideas down before moving on to the next question. CASPer snapshots. Sorry, Pooja, I'm actually not familiar with what you mean by CASPer snapshots. Do you mean as in like which schools require CASPer? Oh, like a 10-minute video interview. Yeah, I'm not 100% sure. I think it's very new, so I'd have to definitely look into it. But we can look into this, and then we can probably send out an email to you guys if you'd like after. Okay. Let's see where I was. So Subdeep, you can definitely write point form. You can write point form for almost most of the CASPer, as long as there's kind of a train of thought and they can follow what you're saying. Point form is fine. I often find when people are kind of writing point form, what happens is you tend to lose structure in terms of how you're answering questions, and so you'll jump from one idea to another, and there isn't a lot of contingency. So as long as you can make sure you have good kind of contingency in your answers and there's some kind of flow, for the most part, point form is allowed. So what if you left a question blank but answer it in the next part at the same station? So you're evaluated based on each kind of question. So you'll have 3 questions per station. And so if you leave one of the questions blank but answer it later, it might make that next question be scored much higher, but it'll take away from your mark for your first question. And so another tip of advice, our little tip is that most of the time with CASPer, after you've done a video or text station, all 3 questions will appear in a row on the next prompt. So you can just scroll down and kind of see the questions and then start answering the first one, because that'll kind of give you an idea of how to approach the first one, the second one, and third one, and you'll not be redundant in your answers, and you'll save yourself a little bit of time. What are some red flags that you should avoid? In this story example, would not report the employee immediately. So, Eleanor, very good point. I think when I say red flags, it's a term that can be applied a lot of different ways. So, what you mentioned right now, would not report to the employee immediately. It could really count as a red flag depending on how you state it. Because if you said the same statement and said, I want to give the other employee the benefit of the doubt and want to go speak to them first before putting their job at risk, that to me that's a fine statement, because at the end of the day, you have a plan in mind about how you want to state this or how you want to attempt this. But at the same time, if you mistake, so I'm not going to report them, that could be considered a red flag, because you're failing to realize that you are in a position of responsibility and you have a policy and a company's you're basically in charge of a company here, and so answering it that way could be considered as a red flag. So I think by red flag, I really mean about how you word things. As long as you're kind of able to explain your train of thought, why you're thinking the way you are thinking, you get away with a lot. But if you have very, very strong statements, you're very opinionated, you don't really back it up, and you leave a lot of it up to the imagination of the evaluator, then a lot of statements can be potential red flags. But if you're able to really elaborate on them, you can make it into a normal point and something that adds value to your answer. Okay. Yeah, sorry guys, I don't really know a lot about the snapshots, but we'll get some information about that and let you know. So writing the CASPer multiple times. So the CASPer is written for different programs, so teachers college, nursing, medical school, applying to the States. It's so there's a different exam from what I can recall for the States and America or Canada in particular, at least. And so you can only write once a year, in particular once per cycle. And then if you don't do too well in one cycle, you can repeat the test again. And so you're not limited with just one attempt forever. It's more so one attempt per cycle. Okay. So what is a good acceptable score for the test? I vaguely recall somebody telling me that this year they've started to kind of give out CASPer scores. Unfortunately, when I wrote it, they didn't really give us any scores, and so it would be hard for me to tell you what an acceptable score is. But from how I kind of understood this test is that it's not really evaluating you, or outside of McMaster in terms of medical schools though. Most schools really are using this as a screening tool. And it's being used to see if you're kind of ethical in terms of how you think, and if you're somebody that's able to kind of be reasonable in how you approach situations, or if you're very opinionated, or if you have very strongly held beliefs that might not align with a lot of scenarios. And so as long as you can approach things and understand the other perspective, for the most part, I think you'll be fine in this test. So Osama, I personally, when I wrote this test, I touched on them through my reasoning. I didn't really talk about, I vaguely remember using the buzzwords very infrequently, because sometimes, when you use the buzzwords but aren't able to kind of explain why you use that word in your answer, it can actually take away. But when you explain the term, you've made sure that you're explaining why it's relevant to the scenario. So, I personally feel it would be, if you can explain the buzzwords through your answers, that would be preferred. But if not, just making sure they're indicated somewhere, just so when they're evaluating you, they know you've considered it. That's also perfectly fine. Can you do CASPer, or does it have to do the same? So, Eleanor, I didn't understand the question about asking a question about a specific scenario you saw. And Lola, yeah, the four big ethical principles: so autonomy, non-maleficence, beneficence, and justice. Oh, perfect. So Eleanor, if you I think with most kind of medical assessments, if you've seen a scenario on the test, they would prefer if you don't talk about it with your peers or people around you, just to maintain the confidentiality of the test, and in case the question is repeated, just to make sure other people aren't given an unfair advantage. And Zara, very good point. So I think you can definitely talk about both sides if you have the time. But if you feel like a question, is definitely, like, in your mind, it's definitely leaning towards one side more than another, you can highlight the other perspective very superficially, but elaborate on why you think it's leaning towards one side over the other. And the CASPer is tricky because it's only 5 minutes for 3 questions, and so they don't fault you if you don't talk about the other side, as long as you've considered it, or you briefly highlighted on it. So Tala, the format that, so I personally didn't really have a very strong format. I think I would just I would approach it, I told you, where it would be discussing both perspectives, highlighting the scenario and kind of coming to an answer. But the ideal way to answer any kind of ethical question or any kind of MMI question from everybody that kind of posts online is, you want to first start by, making sure that you kind of touched on the situation and why it's. Then you want to talk about the different perspectives. So you want to broadly highlight what you're going to be talking about in your answer. Then kind of like one of those charts, you want to talk about one side, explain why somebody might hold that belief, and then you want to talk about your perspective and the evidence behind why you hold your current belief. And then you want to conclude with a concluding statement highlighting your train of thought and what route you would end up actually taking. But because you're only limited by the 5 minutes, it can be hard to do all that. And so as long as you kind of have a train of thought and you're able to explain your answers and explain different perspectives in the prompt, for the most part, you should be fine. Are there any other questions? How's medical school? Man, it's a lot. It's too much. Is this video been? So we did record it. We're going to try to post it. And yep, 5 minutes and 3 questions. Usually a 1 to 2 minute prompt. And of course, guys, thank you all for coming out. And if you have any other questions, you can feel free to message me or message anybody on Future MeMD, and we'd love to help you guys out. Yo, definitely have to plug my Twitter, guys. All right. Well, I guess that's it then. So definitely check out the Future MeMD CASPer course if you guys want more help with the CASPer. But if not, best of luck, and hopefully you guys all kill it on the CASPer.